All, this is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. I think today's talk is going to be one of the most important talks of all the videos that we have done. It's going to be short so that you can more fearlessly share it, but it is really going to be something important for protection of our lives during this COVID-19 issue. So let's start. The credit for this talk goes to, I believe, Jim Marux. And Jim, you are here. I can see you. So welcome. So you had shared that vitamin D talk yesterday, and I'm going to talk about that. So let's start our discussion. The basic takeaway from the discussion today is, number one, we all know that very clearly now that vitamin D has a very important role in keeping us protected. However, what should be the vitamin D level that is the most protective? That is one. And number two, when the vitamin D levels rise, when we take correct amounts of vitamin D and it starts rising, what is the risk reduction from seasonal infections, not just COVID-19, per unit increment? So we're going to talk about that as well. So with this outcome, my request to you is to share this with others who would need to know what should be their level. And let me spill the beans right now so you can actually talk with your friends and tell them the vitamin D level that has been the most optimal to reduce the mortality is 40 nanogram per milliliter and above. So that is the level that must be kept. And secondly, every 4 nanogram per milliliter rise in vitamin D level in our blood, in our serum, reduces the risk of seasonal infections by 7%. The thing that I do not know is that how far above you can continue to take it without causing serious calcium metabolism issues and while staying protected from kidney issues and hypertension issues and other GIT problems, etc. So with this, let's start our discussion. Really important discussion. So this is Drbeen.com. Lots of lectures are here as well. And what we are doing is that we are creating a course, which is again free for all the COVID-19 videos, and that will be posted here by tomorrow. This is an article in Mail Online, which shows or which talks about in general terms, what is the study about and what are the outcomes of the study. This is the actual study, and I have the PDF here as well. This study is actually done on patients in an Iranian hospital, but the study is done by Dr. Michael Holick of Boston University. So a very decent study. I love this study. In addition to that, I wanted to also show you this. Of course, credit goes to whoever took this picture. This is not my picture, but this is on Pinterest. And I wanted to show you this. I feel this is the situation here in the US with our management of COVID-19, that regulations and the commercial interests and pharmaceutical interests and insurance and interests and egos and lack of competence and lack of attention and the political entrenching and digging in their own corners has caused US to get stuck. And so one of such things that I saw was, remember Kivano that I talked about, that is a at-home vitamin D level meter. So they are trying to send me some meters for testing and demonstration to the cool beans here. So I'm just going to read parts of an email that I received from them. And they're saying, unfortunately, the regulations to ship a product to the USA are not as easy as we thought without an FDA approval. They are still sending me 5 kits for testing purposes. I think that is how they could send it. And of course, I'm only going to test it. I'm not going to start selling them or start selling the tests themselves. The second thing that was interesting for me was, or frustrating for me, was that the app that they use with that test kit, they were not allowed to turn that app on to be downloaded in the USA. So they are actually sending me a phone as well, just for the testing purposes, so that I can test it, and then I have to return everything back to them. This is how bad it is, that we know there are things that can be beneficial for the general public, and we have such regulations that have gotten us stuck. What a mess. Vitamin D level meters. So before we go into the study, let me tell you some practical things here. If you go to Google and Google or search for vitamin D at home tests, there are many companies, some good and some may not be as good, but there are many companies that would show up. You can look at their reviews and then decide to get a test done by someone. The test prices are anywhere from $49 to $69. Maybe your own physician can help you with the tests as well, but do get your tests done. Become aware of your levels and then decide to keep your levels at 40 nanogram per milliliter. That is the whole message of the talk today. So let's start. Correct. So there is a comment here that too much red tape. Exactly. So too much red tape may have been, the too much red tape may have been okay in non-pandemic type times, but during the pandemic, when we are in exceptional times, our responses have to be exceptional as well at this time to prevent people from misery and death. And we are not doing it. The healthcare professionals, healthcare administrations, healthcare leaders are not rising up to the time. And that is what really is frustrating me, especially after looking at this study, that how useful it is, just how simple it is to keep our vitamin D levels up, and we are still stuck. So let's look at it. The study says the following. So the study, as I said, it is done on the data from Sina Hospital, Tehran, Iran. It is done by the Boston University, Professor Dr. Michael Holick. This is a cross-sectional analysis of vitamin D levels and the severity of COVID-19. So this is an analysis of the data, not a prospective double-blind placebo-controlled type study. What they did was, fortunately, there was in those patients who ended up in the hospital, their vitamin D levels were tested, were known. That is really interesting. And the cutoff point for normal vitamin D level they used was 30 nanogram per milliliter, and above was the sufficient vitamin D, and then between 20 to 29 was insufficient vitamin D, and then lesser than 20 nanogram per milliliter was considered deficient. So that was the basic levels. What they did was, in this study, they actually had 611 patients, but out of them they chose 235 because I think this was the number for which the vitamin D levels were known. So 235 hospitalized participants, so they were all COVID-19 positive. Their mean age, check out the age, 58.7 years was the mean age. The 37.4% of the patients in this study were greater than 65 years of age. 66% of them had chronic disorders, and 36.6% had diabetes, which is one of an important comorbidity. So that means this data is important because the age group comorbidity group is also very important. They had 77 patients whose vitamin D levels were sufficient. That means 30 nanogram per milliliter and above. And then, so that was 32.8%. So just think about it, that out of every 100 people, 32.8% were sufficient, and all the remaining were not sufficient. In the US, I believe it is 42% or more who are deficient generally. But then various demographies have various levels of vitamin D deficiency. In the UK, I believe it is 20% or more. So 158 participants were deficient or insufficient in vitamin D levels. So that was 67.23%. Why did they put this number out there? This is important for us to realize that out of every 100 people, about a majority are going to be vitamin D deficient. So that means we have to take care of this thing. So then results, what did they see? What they saw was the following. They were, actually, let me start from the death. Lesser than 40 years of age, of all, out of those 235 patients, those who were lesser than 40 years of age, regardless of their vitamin D levels, they all survived. So 0% deaths in there. Greater than 40 years of age, overall mortality was 16.3%. 16.3% patient that were greater than 40 years of age, they died. Now, out of them, 9.7% died who had sufficient vitamin D levels. But compare this to those who had low vitamin D levels, 20% died. So out of 100 folks who had low vitamin D levels, out of 100, 20 will die of COVID-19, or COVID-19 would progress more in them. On the other hand, if vitamin D levels were greater than 30 nanogram per milliliter, then out of 100, 9.7% of hospitalized patients would die. And here is the important most thing. Those patients whose vitamin D levels were greater than 40 nanogram per milliliter, they were 6.3%. Their death rate was 6.3%. So that is the least in this whole group, other than lesser than 40 years of age. So from this, the discussion that they did was that, yes, the endocrine society says that 30 nanogram per milliliter is the right quantity of vitamin D levels. However, those who had 40 greater than or equal to 40 nanogram per milliliter vitamin D levels, they survived the best. And this is where you're talking about 40 years of age and above. We are talking about the at-risk group. Now let's go back here. Let's see here. Hospitalizations and the duration of hospitalization did not change for the people who were deficient or insufficient in vitamin D, or who were sufficient. So 5 days on average for both groups. Similarly, ICU admission. So look at this, ICU admission, 14.3% for those who were vitamin D sufficient versus 20.9% who were insufficient. And I'll show you the data as well, so you can look at the p-values too. Unconsciousness, 1.3% insufficient, and 8.2%, this is statistically significant, 8.2% who were not sufficient. That is a very important thing. Hypoxia, and hypoxia in their definition was oxygen levels below 90%. Hypoxia, 19.4% compared to 40%, almost 40%, or 39.2% in those who were vitamin D deficient. CRP level, C-reactive protein level, which is an indicator of inflammation, and if the CRP levels continue to rise, that is an indicator that cytokine storm is going to occur. So 61% had the CRP level rising in vitamin D sufficient, compared to 77.2% where the CRP levels started rising in vitamin D insufficient or not sufficient group. Why do I keep saying not sufficient? Because insufficient has two levels, insufficient and deficient. So I'm just lumping them together by saying not sufficient. Blood lymphocyte percentage is an indicator of inflammation and cytokine storm as well. So 45.5% had the blood lymphocyte increasing, while 60.1% in the vitamin D non-sufficient level were having blood lymphocyte increasing. So very, very important thing. And I have marked the basic takeaway from this lecture. I've said it 2-3 times now. Greater than or equal to 40 nanogram per milliliter is the target at this time in COVID era. And every 4 nanogram per milliliter rise in vitamin D level reduces the risk of seasonal infection. That means not just COVID-19, but other seasonal infection. This reduces the risk by 7%. Very important. So there was one more study done by the same doctor, Dr. Holick. That study had found that vitamin D level, if they were sufficient, check this out, this is a very interesting thing. People who have sufficient vitamin D level have 54% lesser chances, lesser likelihood of catching the coronavirus. Remember, we keep saying that catching the coronavirus is equal for everyone, because it is really the breathing and the breathing of the fomites. The virus is going to come into our body and it's going to infect us. But can it really infect and spread and convert into a disease? Remember, when the virus appears in our body and starts replicating, we call it infection. When it causes symptoms, we call it disease. So it is possible that the infection occurs and we just take care of it and we never even know that the virus arrived. So 54% of the people who have sufficient vitamin D levels, I'm saying it wrong. People who have sufficient vitamin D levels have 54% less likelihood of catching coronaviruses. That is significantly important thing. So the takeaway, keep your vitamin D levels above 49 nanogram. Also, just make sure that you care for the imbalance in calcium when vitamin D is given. So vitamin D should be given with K2, with magnesium, and with calcium. And you have to kind of keep talking with your doctor to keep looking at those levels, because extra mobilization of calcium can cause blood vessel stiffening and cause aggravated hypertension. It can cause renal toxicity. It can cause GIT toxicity and other things. So just make sure that you are able to look at your levels and monitor them every once in a while to see that other things, other systems are working correctly. So if I can request you today that when you talk with your friends and family, your loved ones, or even somebody you passers-by, tell them to keep the vitamin D level at 40 nanogram per milliliter or above. Tell them to have correct vitamin D levels. They correct it by sunlight, or they correct it by taking supplements, or they correct it by taking food, whatever works for them. But keep their vitamin D levels correct. So now I'm going to quickly show you the study itself. I want to show you the table that has various issues of COVID-19 and percentage difference of vitamin D versus not vitamin D. So if you see here, these are conclusions. Only 9.7% of patients older than 40 years who were vitamin D sufficient succumbed to infection, compared to 20% who had a circulating level of vitamin D lesser than 30 nanogram, which is insufficient. So that's one. Then if you go here, they're talking about what is the role of vitamin D. And I have done detailed discussions many times for the mechanism of action of vitamin D. So I'm kind of skipping that over here. Then in their data, here they're saying overall a cutoff point of 30 nanogram per milliliter was used for the definition of vitamin D sufficiency. And then they said that between 20 to 29 is insufficient and lesser than 20 is deficient. So that is what they said in their results. Out of 235 patients, that is what they documented here. Vitamin D sufficiency was associated with a statistically significant lower risk of unconsciousness and hypoxia, defined by an arterial level below 90%. Then they said serum CRP and lymphocyte percentages in the blood were significantly lower and higher compared to the insufficient vitamin D. And so let me just quickly show you now that table. So this is an interesting table. When you go to this study link, I have that link in the description, and you open up this PDF. This table is interesting, where they have said, so the first column is the issue of the COVID-19 caused by the COVID-19. The second column is those folks who had vitamin D level correct. And the third column is where the vitamin D level was incorrect. And then what was the p-value? The p-values are not enormously awesome, but they still are good. So if you see here, hospitalization, duration, chest pain, dyspnea, ICU admission, So please go over there. I had cherry picked some of the numbers that I thought were important. For example, ICU admission was important, intubation was important, then unconsciousness, hypoxia, C-reactive protein, and blood lymphocyte. And these were all significantly better in folks who had right vitamin D levels. And so then finally, there is couple of more things I want to show you. Here, look at this, each 10 nanomole per liter, which converts into 4 nanogram per milliliter, increase in serum vitamin D level was associated with a 7% lower risk of infection. So that is good. A recent study suggested that lymphocyte percentage can be used as a reliable indicator of the severity and the cytokine storm. So again, I have cherry picked some pieces here to kind of share with you. And then finally, we did observe that 6.3% of the patients, 6.3% of the patients who had a blood level of at least 40 nanogram per milliliter succumbed to the infection, compared to 9.7% and 20% of who died and had a circulating blood level above 30. So above 30 and lesser than 40, that was 9.7%. Greater than 40 was 6.3%, and below 30 was 20%. Thus, a blood level of at least 40 nanogram per milliliter may be optimal for vitamin D's immunomodulatory effect. And after that, they say that now that we've shown this, we would like more data to be collected and more studies to be done and more bigger studies to be done and so on. But this is the talk today. My request to you, please like, subscribe, and share. Share this one as much as we can. If you cannot share it, if you don't want to share it, then just tell people, just yell to them, just shout out loud to them and say 40 nanogram per milliliter should be the vitamin D level. And if you cannot get the level from your physicians, then just Google for in-home vitamin D levels and get that tested. I wanted to tweet to President Trump today to say, if you can do us one favor here in the US, at least approve at-home vitamin D level kits. It's not going to cause much harm. There is no harm, but we can really be safe and we can be better off. So anyways, that is the discussion. I will see you tomorrow. Please stay safe and happy and healthy, and exercise and relax and have fun. Bye-bye.